Arch reconstruction using dental implants can be very challenging yet very rewarding. This patient presented with an atrophic maxilla which required bone grafting prior to dental implant placement. A 3D image cone beam scan was obtained to determine the amount of alveolar bone available for implants, as well as copying of the patient's own denture to be used as a radiographic guide. This radiographic guide is essential in determining the proper axial inclination of the implants to be placed, using the denture as a guide for occlusion. The templates can then be placed into the alveolus and the axial inclination for the implants can be evaluated. The remaining implants are placed in the appropriate positions on the radiographic guide. The radiographic guide is then converted in the Nobel Guide software to a surgical guide. This then is manufactured in approximately 4 to 7 days, and not only can be used for placement of implants, but in the laboratory it can be used to create a temporary prosthesis which can be placed in the patient's mouth at the time of dental implant placement. Once the implants are placed, the temporary prosthesis can be fixated to the dental implants, and then the patient's occlusion can be adjusted. The access holes are covered with acrylic, and post-operatively the patient has a very nice occlusion as well as an aesthetic result. Failing partial dentures can be replaced with fixed bridgework using the all-on-4 technique. The remaining dentition was removed and 4 implants were used to secure a new prosthesis. This patient presented to our office with failing maxillary dentition which required extraction. Her request was for a fixed bridge that would replace her dentition. 6 implants were planned for her maxilla. After bone grafting, a cone beam scan was obtained to evaluate the alveolus as well as create a radiographic guide using her existing dentition. The implants were virtually placed in the alveolus as well as the creation of a surgical guide template. The implants were placed using the surgical guide, and her occlusion and aesthetic results were very pleasing for this patient.